and out to thank you for hitting record. I'm guessing Haida did that for me. So we are recording today. This will be posted on our website along with the tool and the resources when we're done. So please be sure to enter your name and PS number in the chat. That is how we will be verifying attendance for ECP. So just a really brief history on this tool, because I want Simon and Gina to have the bulk of the time. We contracted with Prenatal to 5 Fiscal Strategies to build this tool for us and have been working on it over the past year. We did have a cost of care work group that consisted of some of your fellow family group and center owners across the state that provided really valuable input and feedback as we worked through the tool, and they also reviewed it prior to being finalized and gave some final feedback on it. So it has been out there across the state being tested and used. So we're just excited to get it out for everyone. So I'm just going to do a quick introduction for us. So Prenatal to 5 Fiscal Strategies is led by Gina Capito and Simon Workman. Gina and Simon are nationally recognized experts on prenatal to 5 fiscal issues and have worked in close partnership for nearly a decade. In this time, they've conducted comprehensive fiscal analysis projects, developed revenue and expense models, and have provided technical assistance on prenatal to 5 fiscal and governance issues for numerous states and communities. They are the only consultants to have supported states in using cost modeling to inform CCDF subsidy rate setting. Gina and Simon formalized their partnership with the founding of Prenatal to 5 Fiscal Strategies in 2020. P5 seeks to address the broken fiscal and governance structures that exist within the P5 system with a comprehensive cross-agency, cross-service approach. This initiative is founded in a set of shared principles that center the needs of children, families, providers, and the workforce, and fundamentally rethinks the current system in order to better tackle issues of equity of funding and access. And so just a quick additional piece of information for Montana. Simon and Gina are also going to be starting the work for a comprehensive fiscal analysis across our entire early childhood system in Montana in partnership with both us at 0 to 5 as well as the Department of Public Health and Human Services. So be watching for more information about that over the coming months, but we are thrilled to have them leading that work for us as well. So with that, Simon and Gina, I'm going to turn it over to you as soon as I stop sharing my screen here. Okay.
Thank you, Rhonda. Thank you for that introduction, and thank you everyone for joining us today. I'm Simon Workman with Prenatal to 5 Fiscal Strategies, as Rhonda introduced us, and my colleague Gina Capito is on the call as well. We're going to share a few slides to some grounding, and then we'll jump into actually looking at the calculator tool that we're here today to talk about. Rhonda kind of covered this, who we are. We are national, but have been working in Montana for a while now, and very excited to be able to continue doing that with the comprehensive fiscal analysis. So today we're going to do some grounding on what we mean by a cost model or a cost calculator, right? There's these different terms, and we'll get into that. Then we're going to talk about the specific model that has been developed for Montana so that it's a very customized tool for your state. Then we'll walk you through a bit of a demonstration of the model and have some time for any questions or feedback you have about it, and then share out some of those resources. So without further ado, I'm going to hand it over to Gina, who is going to walk us through our first section of content.
Thanks, Simon. Hi, everyone. I'm going to go fairly quickly through these concepts because we're going to spend a little more time with your actual model, but just as a grounding, some kind of core definitions, as Simon mentioned. So the first thing that we want to talk a little bit about is the nature of the childcare market in relationship to a cost model or a cost tool. As you all well know, as providers and leaders in this space, that the childcare market, unfortunately, is a foundation that we're we're all kind of operating on, which is broken. The idea of publicly funded subsidy rates that are informed by the tuition that a provider charges families is where that kind of inherent brokenness comes into play. Because the reality is that this approach would only work when families are able to pay the full cost of care. And the reality between just how expensive it is to provide childcare, because it is a very provider heavy, relationship heavy product that we are offering out to children and families. Also combined with increased quality standards, care cost more than what most families, especially lower income families who qualify for the subsidy, can actually afford in their out-of-pocket month-to-month expenses. Unfortunately, the dynamic for public subsidy rates is that historically, for several decades now, the market rate or the tuition that's charged to families has been what has been used by states to inform their public subsidy rates. The disconnect there is then that places where families pay less in tuition because of being lower income get less in subsidy payment. And it sort of becomes very much of a broken cycle that occurs then, because families are paying less, providers in that community are then able to access less from the publicly funded subsidy rate. And so when we think about this broken market, what we are trying to really begin to understand is what the true cost of care is, and have cost of care inform publicly established subsidy rates. We are in a lucky space that is something states can do. States can move to using cost to inform their subsidy rates. There is certainly understanding the market that is helpful, but understanding the cost that providers are incurring in order to deliver the service to families and having that inform subsidy rates is a huge piece of starting to address the broken childcare market. What we know and that you all have had access to for many years is a cost calculator tool that it helps you understand a little more about what your costs would be under a given set of circumstances. That is very similar to the type of cost models that states use in order to use cost to inform their publicly funded subsidy rates. So with that in mind, I'm going to take us to the next slide where we talk a little bit about this concept of a cost model. The idea when states are moving to understand cost, instead of using a tuition-based approach to setting their public rates, is that a cost model helps states to understand the variety of reasons that cost varies across programs. That starts with the concept of what type of care it is. A center-based program compared to a family childcare program could have very different business models, so therefore often have different expenses in their delivery of childcare. The ages of children that a program serves and the differences between the regulations or requirements to serve different ages of children, like infants having smaller group sizes and more teaching staff compared to a preschool or school age child, all have an impact on cost of the services delivered. So there's a variety of characteristics of programs that get folded into a cost model or a cost tool or a cost calculator. As Simon mentioned, there's several terms that you sort of hear used sometimes interchangeably. And at the bottom line, what those tools are trying to do is support an understanding of the cost that providers are incurring in the delivery of childcare. It also is a tool that can be used to understand that if you have multiple types of funding and you leverage in multiple types of funding, that you have different expenses. Same thing comes along with meeting higher levels of quality under a quality rating system. When you meet those higher regulations, higher quality standards, your costs are going to be different than if you're just meeting basic licensing. All of this gets built into how cost models function and supports understanding that potential gap between the cost and the revenue that's available to a provider to serve children, to deliver those services. And so cost modeling tools, I mentioned on that last slide that states are able to use a cost-driven approach to inform their subsidy rates. And so that's often where policymakers and legislators are then really thinking about cost and how they drive those publicly funded subsidy rates informed by cost. But there's also the opportunity for these tools to be really useful for providers in thinking about your current program. If you were to make some changes to your program, maybe seeking to grow it or seeking to pay higher salaries, whatever those sort of adjustments might be, having access to a calculator or a modeling tool can support you to model different scenarios and think about what that might look like. One other thing that we like to highlight as part of sort of understanding the differences across the way the market currently functions is just a little bit more of that sort of enforcement of definitions. In our space, there are 3 core concepts related to the delivery of childcare when it comes to price or cost. Price goes back to that idea of the market rate or the tuition that a family is charged. That is what families can actually pay. It's what the market, in essence, can bear, families being the market that are purchasing childcare. It is not typically the same as the cost a provider is incurring, because a provider is making a judgment call around, I may know it costs me $1,000 a month to deliver care to an infant, but I also know that families in my community can't pay $1,000 a month. So I am going to set my tuition lower, and that's the price I'm going to charge a family for what I'm offering out to them. When we build modeling tools, and you'll see this when we get into the example of the tool that was built for Montana, we don't just stop at the idea of reflecting your current cost or the current actual expenses of a program, because we know from many, many providers across the country and doing this work ourselves in programs that the actual expenses that you would find when you crack open our budgets is different than what the true cost of care is, because those actual costs currently are very much influenced by available revenues. And it comes down to examples that we hear again and again around things like the cost of living increases or the compensation that are offered to the staff in programs, that programs will reflect that they would really like to give a raise, but there's not enough revenue available to increase someone's salary, that they would like to offer health insurance and pay a portion of that health insurance, but there's not enough revenue, that the budget is we're already over, and we can't keep the doors open if we pay for health insurance for employees as well. So factors like that, especially when it comes to workforce or in compensation, are what we then think about as the true cost. And modeling tools give us the opportunity to have true cost features in them to understand what is the difference in the cost of care to serve a child where staff are only paid minimum wage and they don't have access to health insurance, compared to where I pay staff a living wage and I do offer health insurance. You can right off the bat, just those 2 differences in a modeling tool, see the difference in the output of the cost per child in order to offer the service at that more higher compensation, and compensation that reflects what folks need to live in your communities in the case of living wage and health insurance. So we really want to make sure that we don't stop at the yellow and just think about cost, but that we move to that world of green, which is in some ways maybe a North Star for some communities around what compensation should be or how we ensure we're covering the full cost of care, that true cost of care. But the cost model gives us the opportunity to really understand it and to have the answers to the question of how much does it truly cost, and what is it, how much is that different than what our current costs are. So the next thing that I want to do before we move into actually working through how the Montana model was built and then doing the demonstration of it is just a little bit on the idea of how models function. I just gave a couple examples of choices or selections that you can make in a model, and wanted to highlight that that's kind of entirely, when we think about this sort of tool, it's made up of a series of selection points. At its most simplest, the tool is an Excel workbook. And so you see here on the screen a couple examples of screenshots of Excel tools that we've built for other communities and states, just to really emphasize this point that you are putting in inputs as the user that is then going to get you those answers to the question of what is the cost per child. And that is based on what you're seeking to understand the cost per child. If you are a birth to 5 program, then you're going to put in children in the birth to 5 period, and you're going to then make selections around things like health insurance or sick days, or in the case of this particular example, what are some additional enhancements that you may offer as a program or may be interested in offering, and what would the cost of those enhancements be? That's sort of your query of the model. You're saying to the model, I'd like to understand a birth to 5 program that does these things. You then make those inputs into the tool, and then you'll get the output around cost per child. And we're going to look at exactly what that looks like in Montana's actual tool. But I wanted to share just at that highest level of functioning that it is an interactive tool. It is designed that you get to ask it questions, and then it gives you different answers, and then you can change those selections that you make or those questions that you're asking of the tool to get different outputs or to be able to compare outputs across. So it's really important to understand how you have a lot of control of what you get from the model because you are making the selections and making the inputs and how the model functions. Along those lines, the reality is that when it comes to how cost models function, there is not necessarily a single answer from a cost model either. This is something you may hear a lot as a provider or sort of a leader in this space, that idea of, well, what's the cost of childcare in Montana? Well, it depends. The answer has to be it depends, because it depends on if the question is being asked to serve an infant in a center versus a family childcare. There's a lot of different factors that dictate what the cost of childcare is. And in the same way that it depends to the answer, that there's no single answer to the question of what childcare is in your state, depending on what you put into the cost model will dictate that output that you get. So if Simon and I both use the Montana cost tool right now, and one of us does school age children and one of us does birth to 3, we are going to get 2 different outputs from the cost model because we were making different selection points. It's not broken. That's exactly how it's supposed to function, because we asked it for 2 very different questions around cost. And so the only way you get the exact same answer out of the cost model is if you put in all of the same inputs as someone else into the tool, then you should get the exact same answer out of the tool. But otherwise, there is not a single answer, and that whether or not you get the same answer will vary based on the choices that you make. And that we talked at the outset that program type and size of the program and ages of children served, those are all variables that dictate why you get different answers out of the cost model. And they're also all those things that you get to sort of turn on and off and understand the different outputs from the cost model along at the same lines. And things like stars and other quality enhancements are also built into the tool for your state. So with that little bit of overview of sort of core definitions and things around how models function, I'm going to turn it back to Simon to talk a little bit more about how the model in Montana was built.
Thanks, Gina. And so Rhonda covered a little bit of this at the beginning, but just to kind of give you a bit more of the background, we did form a work group to guide development of the model. It wasn't just something that Gina and I sort of did on our own, because it's always very important to make sure that, to Gina's point of that price, cost, and true cost idea, right, is to really understand the costs and the true costs. You have to be talking to providers about how you're actually doing it right now, right? So we formed this work group with the support of 0 to 5 and other partners, making sure that work group had representatives of both centers and home-based childcare programs, and from different parts of the state and at different places within Quality Stars. So then what we do is we look through the childcare licensing standards and the STARS requirements and identify what are the key cost drivers, what are the things that actually within those requirements, those standards, have a cost related to them. And a lot of that requires looking at and saying, if there is an activity that is required, such as professional development, it's about how is that a cost to the program. Even if the professional development is provided by the state, for example, there is still a cost related to the program of giving that teacher release time to go and do that professional development. You're either paying them overtime on a weekend or an evening to do that professional development, or if it's happening during the school day, you are then needing a sub or a floater to come in and cover for the classroom. So that's the sort of way we're identifying, what is a cost driver that maybe is not so obvious as a cost driver at first, but it's when you look at what does it actually cost a program to meet the requirements they're being asked to meet. Then, of course, to sort of inform them what those costs are, like what the values are, what the dollars are that relate to those costs, you have to look at actually get some data to inform that. we were able to utilize some existing data collection that had happened in the state. So the ARPA survey that you probably all did related to COVID pandemic relief funding that the state did, we were able to access some of the data from those surveys to inform this so that we didn't need to go back out and survey providers again, because we know you get a lot of surveys and it can end up being a lot of extra burden. And then also looking at state licensing data about program sizes and capacity, etc. And then, of course, we weren't starting from scratch. There was the existing calculator that had been developed and that had some great data in as well as work we have done across the country, including at the federal level on sort of estimating costs in programs. And so often we'll get asked this question of, well, how did you get all the cost data without surveying everybody? And this sort of points to where we were able to collect and utilize existing data. But it's also important, reflecting back to where Gina started our conversation, is that we are trying to build a model that really clarifies what it actually costs to provide care, right? And we know that at the moment, the way a lot of you are forced to operate is under a scarcity mindset, where revenues are extremely limited, both on public and private funding. And therefore, maybe you are not staffed at the full level you'd like to be. You're not paying at the level you'd like to be. You're not giving paid planning time and sort of paid professional development, right? And so the model is intended to capture, actually, if we don't operate from a scarcity mindset, if we look at what it actually costs, what it actually takes to do this work, what does it cost? So we developed the calculator. We did share with the work group for feedback. We shared it at the Montana Childcare Business Summit back in September, and then have refined it since then based on feedback and some piloting with providers to make sure it is even more aligned with the needs of the community. And so sort of just to give you this overview of sort of how it works, right? It is built that it can estimate the cost of serving children birth through school age for a full day, full year program. The model, you'll see as we dig into it, has variations. You can sort of say, I only serve these age groups, right? You can put that in, but it has the ability to do the full birth through school age. And there are some things that are just automatically included, right? Mandatory employer taxes and coverage for breaks, meeting health and safety standards under licensing, the mandatory taxes and mandatory things you have to do are included in there sort of behind the scenes. And, we focus a lot in the model on compensation, because compensation is the largest cost driver, right, in any program in this labor intensive industry. But the non-personnel expenses are in there and are, of course, important. So education materials, supplies, both for the child level and at the staff level, occupancy costs, program administration costs, and transportation. And then the model, while we do talk about it being a cost model, it does integrate revenue, so you can understand how far revenue goes to covering the cost, and what a different mix of revenue looks like based on to cover the cost. And so built into the model is the subsidy rates as of the new ones that were published as of March 1st, 2024, including the additional amount for certain counties. The name is escaping me right now, but the certain additional amount, 15%, is built into there as well for those in those counties, as well as the additional incentives you get for being in STARS and the tiered reimbursement related to that. And there is the ability to put in tuition rates as well to capture those costs. And so what you'll see as we dig into the model is there are all these sort of different, what we call variables. And these are the things that are really driving the costs that are separate to the sort of things like mandatory taxes that are just automatically in there, right? There are variables that are going to have a big impact on driving the costs. So ratio and group size is obviously a big one, because that determines how many people you're going to have in the program, right? That compensation, personnel costs being the biggest driver, is of course about what you pay people, but it's also about how many people you have. So in the classroom, we are using these ratio and group size data from licensing, as you see up on here. And then there is an option in the model, as you'll see, to modify those, but I'm sort of getting ahead of myself to show what's in the model. On home-based care, obviously, it's a little bit different because you don't have those ratio and group sizes as much aligned with ages, other than the, how many children under 2 you can have. So once you get into the model, you'll see there's the ability to put in different ages of children, and the model will then determine if you're a family childcare or a group childcare, and then the appropriate staffing you need for that. And on the occupancy side, which is probably the biggest non-personnel expense, again, aligned with licensing, there's a minimum of 35 square foot of space per child, plus the additional space for support functions and the outside space built into there as well. And what you'll see as we dig into the model, there's lots of defaults included to make it really easy for you to just sort of run some numbers in the model. But there's also one of the things we implemented based on feedback was there's lots of places where you can overwrite the defaults to make it more specific to your actual program. One of the big places where that comes up is around compensation. So the model has 3 different options built in as a default for salaries. But again, you can overwrite these with your own data. And this kind of goes to the purposes and the different uses of the tool, right? If you're using it to really model something out in your program, you probably want to put a lot of your own data in. But the model is meant to also be helpful for advocacy, for policymakers, for sort of understanding that bigger question of what does childcare cost so much, but teachers don't get paid enough, right? That sort of disconnect. And so a lot of the reason the defaults are built in there is to sort of use it without having to put your own data in there and just show the difference. So the 3 salary options that are in here are BLS, which stands for the Bureau of Labor Statistics, which is a data set that is put together by the US Department of Labor with data for every single state. And that's based on surveys of professions across each state about what the average salaries are. And you can see here that using that data, the average salary for a lead teacher in a childcare center is about $32,750 a year. Because what that means as you go through the salary schedule there is that an assistant teacher is then at $26,480. What we wanted to build into the model as well is higher salaries, because we know those salaries are really hard to be recruiting and retaining professionals. And as you look at minimum wage increasing in the state, right, that $26,480 is below $15 an hour, which is, ultimately where your minimum wage is moving to. So that middle category there, BLS adjust 15 floor, and that sort of abbreviated name, moves the lowest paid person in the program, the assistant teacher or the floaters, to that $15 an hour floor, which is $31,200 based on a 40-hour week, full year program, and then adjusts other salaries upwards, right? So that you don't get wage compression. So then the lead teacher is at just about 38,000. The final column there is the sort of what is called the MIT living wage, which comes from the MIT living wage calculator, which is a calculator that estimates what does it cost to live in any community, right? And that's based on what are the expenses a family has to cover, childcare, housing, health costs, transportation, etc., and sort of estimates what a person needs to make. That is kind of an increasingly used definition of the sort of higher salaries that we should be paying in this field, which sort of breaks any link between credentials, right? Often you talk about K-12 parity, but of course then you get the question of, well, do you have the same credentials as a K-12 teacher? The MIT living wage sort of removes that and says more about what is the value that you put on this profession, and if the value is it should be a job that makes a living wage, what would that be? And so that's the sort of, when you get to different purposes of the tool, that would be a place to sort of be like, what do people really need to make in this? They're currently making 32,000. They should be making 67,000, right? So you can run the model, say, and what would that cost? And who can afford that, right? And that's why families need a lot more support. In the home-based scenario, obviously, we know that most provider owners don't pay themselves a set salary. They kind of take whatever's left over at the end of the month. But we also know that means they are woefully underpaid, and especially when you break it down to an hourly basis. So the model captures a salary for them, even though obviously the model is not making any determination about someone needing to be paid a salary, changing any employment status or anything like that. But it's about capturing, when we look at costs in the model, the actual costs inclusive of paying people what they are worth, rather than just saying, you're getting whatever's left over at the end of the month. So those salaries are pegged at the hourly rate for a lead teacher, but at a higher number of hours per week per year, based on the fact that the provider owner is usually there more than 40 hours a week, right? If the program's open for 50, 55 hours a week, they are there that whole time, versus a lead teacher in a center who is more likely to be contracted for, a set 40 hours a week. The other thing I'll note underneath here is that we do have the option to include health insurance in the model, or sort of any contribution to discretionary benefits. So again, there is some data from the Kaiser Family Foundation on what is the average employer contribution to health insurance in Montana, which is just over $6,000 a year. Or you can include a flat $5,000, $7,500, $10,000 amount per full-time equivalent in the program. And while we know, in programs, you might be paying $10,000 in benefits for one person and $2,000 for another person, right? The model doesn't require you to kind of put in every single amount. It is using an average, right? So you should think about that number as a sort of average across the program. And you can also include retirement as a percentage, and then sick leave and paid leave as defaults, which can be modified as well. So I think we should now jump into the model and take all this out of theory and put it into actual practice. So I'm going to pull up the model, and this is where...
Simon, do you want me to drive on the model?
Sure, yeah. Do you have it ready?
Yep, it's all ready.
Great. So Gina's going to walk us through some scenarios in the model. And as she's doing that, we will pause for questions after that. But if you have any questions as we go, feel free to pop them in the chat, and one of us can be responding while the other is talking.
Okay. So picking up with what Simon was just mentioning, you'll notice in the actual tool that there's lots of things that are highlighted yellow. And those are, as you can see from the instructions here, those yellow shaded cells are clearly places where you want to adjust an input in order to do something different. Otherwise, if you open it, so right, I just opened the workbook. It's just going to be the things that were already there are going to be used in that. That would be the output that I'm going to see here at the bottom. So just to give you an example of what that looks like, as Simon mentioned, there's licensing and then the different star levels that you pick from. So once you make that selection, make a selection to this area, which is going to be one of your key first things you want to do. If any regulations, standards that come at the different star levels are then going to be used in how the model functions. So you don't have to worry about, did it take into consideration X feature of star level 3, like the making that choice of star level 3, it's going to flow through. So I'll go ahead and just pick star level 3 since it's a one that I randomly used. I happen to be on the center-based model. You'll notice that just from this next section, which I'm going to zoom in a little because I realize how itty-bitty these things actually look on Zoom. But so you see the next section here is the size of the center. So that's a tip-off that you are in the center-based model versus the family childcare. There's 2 tabs. And so the other model is right here. Again, very small. So zooming in. And you see the big difference at the top around enrollment regarding, instead of seeing classrooms, you're seeing ages of children, and you'd put in the number of children in each age category that you were seeking to model. Or if you were using your own program as an example, you could put in your current enrollment. Okay, I'm gonna hop back to the center-based one. So all you do, it's very simple in the yellow section, is you just fill in. So for ease of calculation, I'm just gonna go ahead and do one classroom of each age group, which you see it automatically does all the calculations. That gets us to 4 total classrooms. And in the case of the, I'm sticking with the defaults that come with a star 3 and your licensing standards for ratio and group size. I'm not changing those right now. So the total number of children and the ratio and group size that is being utilized in this scenario that I'm running is right here in columns D and E, and the total number of children for this scenario is 84 children across those 4 classrooms. And you can see how it gets to the 84 is based on the group size for each of the different age bands that we're modeling. That one of the first pieces and feedback that we received from all of you, actually, as part of giving us input into the tool and how you wanted to be able to use it, it was over here, you see user input ratio, user input group size. That was added to how the model functions because we heard from many programs that you may have been licensed for a smaller number of children just based on the size of a classroom, and that you wanted to be able to have that flexibility in using the tool. And so that's what's happening over here. So you can go ahead and put in there, instead of the ratio of 4 to the group size of 12, we could do 3 to 9, right? So, and it's going to change, and it changed right over here. It actually changed the ratio of 3, group size 9. What's nice about the way it functions is it does allow you to leave your selection that the default for the other age group. So you don't have to go in if you just want to change and do a user input for one age group, you don't have to go in and fill in the amounts for all the other 3 age groups. I clearly have to leave where my dog is because the dog is, there's something out the window the dog is very excited about, so my apologies. I'm gonna move myself here while I talk. So the further down, then you see, and this was another area that Simon was really highlighting on functionality, is related to salaries. And so you see those selections that we looked at in one of the slides. Then you also see, and this is where you have that opportunity to really be tailoring to how you're currently delivering services, what you're currently paying. You would choose, just like we talked about the user input up above, you'd select user added. And if you select user added, then you do need to go over to just to the right there, and next to user added, fill in an hourly value for the lead teacher, assistant teacher, and the floater positions in order to use something different than what the salary structure that was included in that chart on the slide has for salary points. So this gives you lots of nice functionality.
And Gina, I'll just jump in there and say, and if you scroll over to the right, it will show you actually what the salary data that is being populated there, right? This is in the technical manual, which we'll tell you about in a moment. But just as you're doing that and sort of wondering why is it only putting the lead teacher salary in, when you put that 3223 in on the lead teacher, the model is automatically then calculating what the director would be based on the sort of delta of usually what a director makes above a teacher. And you can see that over here in this pink table.
And you'll also notice that it drew the star 3 selection that we made is here in this cell. So that flows through. So if there's a salary differences coming with star level, that's also flowing through to how this salary detail works. So then continuing down in the yellow sections, we see some of those different variables that we talked about sort of coming to life and the choices that you can make. You can choose yes for discretionary pool, which can include health. It could include life insurance, vision, right? It could, again, it's designed to be a pool. And the idea here is that there's several different total amounts of the cost of that discretionary pool, and you can pick among them. The 6206 is that source from the Kaiser Family Foundation. We went a little below and a little above it as well for you to have options. And this is the you think about it, if you're the owner of the program or the director of the program, think about this as the the employer share of, if you're thinking about it as health insurance. If you want to try and pin it to that's a way to think about what this is. This does not include that the employee may have some share that they're paying towards this access, this discretionary access. And then you see here in retirement, this is the first time we're running into, in addition to some of the dollar amount ones, but you see there's an opportunity here to include a percentage for retirement. And so not a drop down, but instead you'd key in a percentage if you were including the percentages of this total salary that's paid. So that we end up with 300,000 in salary paid and we put in 10% here to go towards retirement, then the expense that's going to populate there is going to be 10% of 300,000. And sick days and paid leave, it is defaulting to 10 days annually per FTE of sick and paid leave. You can go higher or lower if you want to on that. This is not including holidays when the program's already closed, because that this is instead the additional paid time off that are offered to staff. And then we move into program enhancements and can make different selections. You see that the couple things already selected is that there's one conference a year in the scenario, and this is just keying in a number. So if I was running a program where I was offering 3 family engagement conferences a year, what this translates into is an expense that allows for the teaching staff to have time outside of the classroom to engage with families. It could be in a home visit, or it could also just be time in the building where they're meeting with families, where they're not responsible for children at the same time. So the expense is then a substitute to go in and care for the children, so the teaching staff can go and participate in these family engagement activities. I'm going to go ahead and leave transportation zeroed out, but you'll notice that there is a amount that's keyed in here. You can also change that annual cost per child for transportation. So not only can you choose yes or no on how many children are covered by transportation, you can change the cost of that transportation, and that's a per child value. So you can see that there's a lot of things that the tool was designed to be as flexible as possible for you as the user to do more things with it, and to be able to really tailor it to your circumstance and how much you want to think about. Maybe you don't currently cover transportation, but you'd like to start. So you want to start at a low amount and see what's reasonable within your budget and with your revenue. And so in interest of time, I'm going to keep us moving. Another variable that's driven by percentage is operating reserve. We include this here. It too is something you can key over, go up or down from the 5%. It's something that all programs I know are striving for. It's also one of the hardest things in early childhood and nonprofits is to have a strong operating reserve. But this is a nice feature of a modeling tool because it gives you the opportunity to understand like how much more is it going to cost for me to try to be building this operating reserve. And here in the non-personnel, there's a few features here to this particular section of the calculator. So there are default values related to non-personnel that the calculator is using, and there's probably about 3 dozen line items that are rolling up to these 4 big categories of education program, occupancy, program management, and then those family conferences. You see that the 3 descriptions of the buckets, that the line items. So there's a lot of line items within each of those buckets: food and classroom supplies, educational materials. And so we're using default data for the state of Montana on these non-personnel expenses to get, based on the number of children, because most of these things translate to a per child value, this dollar amount changes. So if we had 40 children instead of 84, you would definitely see these values be lower than what they are for 84 children in our scenario. And we also give you the opportunity, and here there's a drop down, to enter these annual values yourself. And so user input in this example. If you choose to do that, so it zeroes out the defaults and you have to put the user entered values over here. These are annual amounts in this column here, as it says up there, the annual total. So when you go to enter these, and what you may be doing as a program is really trying to reflect your current non-personnel expenses, and you want to see them in the tool, this is the area that gives you the opportunity to do that. We heard that feedback at the summit that folks would like to have this additional functionality. We just want to make sure that folks really see that this is where you'd put everything, right? So you'd really make sure you covered all your non-personnel for a whole annual 12-month cycle. Otherwise, your output of the cost model could be underestimating expenditures. Yeah. You could also leave something off if you were to wanted to understand, like, well, if I didn't pay occupancy, how much would my cost per child? But that's a different reason to leave something off. So just want to highlight that. But it also gives you the opportunity to go back to the default value, and then in doing that, sort of compare the default values to your current expenses as well in the non-personnel area. As Simon mentioned, the revenue is in here as well, and you have the opportunity and how the tool functions to map how many children are covered by the state subsidy. And then also, then you're going to end up with anybody that's not covered by state subsidy is going to default to a tuition payment. So we kind of assume that all children have some revenue following them if you're providing care to them, maybe except for our own, but that's a different issue. And that what you can do as a program to really understand the tuition component of the revenue better is fill in your individual tuition rates here. So you can key in monthly tuition rate values, and then you'll get a more accurate picture of, based on what you charge in tuition, and then X number of children funded by subsidy, what does your total expense compared to revenue look like? There's a few other features here around this, like the high growth county subsidy differential, choosing yes or no. So this is that sort of thing that if you don't happen to live in one of those counties right now, or your program's not in one of those counties, understanding the impact of that differential, you can run that in the model to understand that. Selecting whether or not you participate in the food program will then determine whether or not you get food program revenue as part of the revenue output. And then you have the opportunity to just fill in any other revenue, any other income here. It's just an open cell. I want to get us to, I'm watching our clock here, Simon, so I want to get us to show some results. But there also is enrollment efficiency and bad debt, which are both going to be a modifier on revenue in essence, because they relate to especially like think about bad debt. If you're not bringing in all the money that you can, like on subsidy, you're not getting paid by the state, then how much are you losing? You can put in a percentage there. And so what we find is helpful is to have what's typical for childcare programs in these two concepts, and those default amounts are sort of already keyed in there. You can modify those based on your experience as a program too. So now here we are in the results section. Oh, and when we were talking a little bit about how models function, I'll start us over here. Didn't quite get into the idea that it's a cost per child output. While it functions at initially an annual level, we also break it down to monthly and weekly, because we know that you may be looking at monthly tuition payments or weekly tuition payments. So comparing your cost at those different levels, not only thinking about it just as an annual cost, can be really helpful. So the scenario that we've been sort of working through, which has all ages of children from birth to school age, you see the first section here is the cost per child, again, starting with annual, monthly, then weekly. The next box, or the kind of peachy colored box, is the subsidy rates that are available to cover those ages of children. And then what the green box does is it gives you the difference between the cost and the subsidy rate. And you see in this instance, it's red for all ages of children. Some higher value red than others. If we just look at the infant toddler age band, it's a $17,000, almost $18,000 difference. The gap between the cost, the cost and the revenue. Whereas if we look down at the school age child, the program's only losing annually on one school age child $1,000. So pretty significant difference in loss for the program, which has a lot to do with we talked about earlier, that the variable of that certain children are more expensive to serve because of regulations and the rigor of their care. And infants and toddlers obviously are in that category.
And of course, the reason the gap is so big in this scenario is because I think the salary selection that Gina selected earlier on, right, is that user entered with a $32 an hour for a lead teacher, which if you reflect to, current salaries are much closer to the $15 now. So when she moves that to the $15 adjustment rate, now you see there is less of a gap, but that red is still there for infant toddlers, right? So kind of what you all know very much is that the gap between what subsidy can pay and what it costs is so much larger for infant toddlers than it is for older age groups.
And you notice in looking at this that you see that this program in theory is making money, right, off of twos through school age, but the reality is that it's actually that they're keeping all the plates spinning by having older age children that they make money on offset the infant toddler age period that they are losing money on. It's actually a way to keep your doors open more than it's like you're making money off any age of child. You're balancing your budget. It's probably the better way to think about it. So then the other piece of results, I know we started with the cost per child output, but then you have a detailed results table that does several things in summary fashion, kind of puts it all right in front of there. So all of the different selections that you made up here and things like non-personnel values and that are all summarized down here in this blue table. And that starts with first that at the highest level, what's the staffing profile? There's 14.9 total FTEs, and 11.9 of those FTE for this program are teaching staff in order to meet the ratio and group size regulations that we selected. Then you see all the different expenses of the program broken down by personnel and then non-personnel. There's the total number of them. So the wages at sorry, my screen's being a little funky, at just over 500,000, but then you also see them as a percentage of the overall expense of the program. So you see that point about how much the compensation of the workforce is of program operations. In this scenario, it's 68%, and that was after I went back up and lowered the salary selection that we'd actually made. So if we were back at the $32 an hour, the percentage of expense would be even higher for personnel. You see all of the broken down non-personnel. Contribution to operating reserve ended up being at 5%, ended up being 47,000. So that's something that you can kind of play around with a little bit and say, okay, well, maybe this year 5% is not reasonable. A lot of times when we talk to new programs, they talk about that putting things into operating reserve is just not something that they can do in the first couple of years. A modeling tool can help them think about when it does become a viable part of their budgeting. And then our income options are down here. So I didn't really do anything besides what was already keyed in for subsidy. So subsidy income's pretty low. And then a little bit of STARS incentive dollars. The tuition, this program is really highly relying on tuition. If we then still taking into consideration, you have your total income, and then you have your total expense. Just on the surface, income is higher than expense, just over $1 million compared to under $1 million. But then if we take off the bad debt and enrollment efficiency values, so that we're not earning as much of that revenue because we don't have as many children in seats, or we are not earning it because our payments are not coming in, that adjusts our income down, and now the program's actually operating at a loss of 163. So working on things like enrollment and ensuring that children are in your program and that you're being paid for those children can have a significant impact on whether or not the program is able to balance. So if we change this to 95%, enrollment efficiency instead of 85%, it cut that loss in half right there with just that one tweak. All right, so that is a walkthrough, and I know we're pretty close to our hour, so I think I'm going to turn it back to Simon for some of
But
the...
just before you pull down that, Gino, just very quickly, the family childcare home tab is very similar, right? We focus on centers. It has a bit more functionality, and it's because of some of those areas you're picking on salaries. But as you'll look at this, you'll see it follows the same pattern, the same type of things, right? That you're putting into there. So just did want to flag that is as well. And when you sort of build up the numbers, right, it will function in the very same way. And when you go down to the results, the only thing I would flag is on the results per child is that because there is not the ratio in group sizes, right, there is not by the cost model an actual difference in a cost per child between infants through preschoolers that is for school age because it's assumed they're not there, full time. We know that most people do charge, or many people charge a different amount based on age and family childcare, but the cost model itself is not driving that because there isn't the ratio and group sizes in classrooms, which is why the gap data in the sort of third box there looks a bit different, right? You don't quite see the same sort of inference through school age, like opposite way as in the centers, just by the nature of how that program is.
The same total summary off to
Yes.
the left too.
Yeah. So I'm going to share back again now, and just we obviously there's a lot of information there, right? And so hold on, are you seeing my screen?
No, we are not.
No, sorry. Speaking and sharing at the same time, it's hard. There's a lot of information we just shared with you. There are lots of resources available. So, the calculator and the resources are now available on the Montana Childcare Business Connect website. It's very exciting. It is now out there. But we've also created lots of resources to help you use it, right? In addition to this webinar, which is also being recorded and will be posted and made available to people, we did write a whole technical manual that details the methodology and the data sources and sort of how the model works, like in more detail. So as you're going through the model and you're like, wait, what did Gina and Simon say about that number, right? You can find it in the technical manual. It is a fairly technical manual, so we also created a brief user guide, which is just a bit more of a higher level overview of the tool and sort of how to use it and some of the key things. But then when you want to get deeper into exact where data came from, that's where the technical manual comes in. And then also, you might be thinking, well, how are we going to use this tool? How does this tool get used? I think we've talked a few times about how hopefully you as providers can use it in sort of your day-to-day sort of thinking about your program. But we also sort of think about how is this driving the field forward, right? And recognizing like the broken business model that we currently have, right? Where families can't afford it, subsidies not enough. And so, using a tool like this with Montana specific data in to show some transparency into everything that you all know every day when you look at your budgets. And that's why we are writing this series of sort of short, very easy to digest profiles that sort of illustrate some of the results from the tool and demonstrate key findings, such as, what happens if you don't have infants and toddlers in a program, right? What does it mean to raise salaries when minimum wage goes up? What does that do, etc. And putting those in a sort of shorter, easy to use way that you can hopefully share out with your community and the rest of the people who are focused on improving resources for childcare providers in Montana can use as well. So those are coming soon. We have a couple of them sort of almost ready to go. We're going to be releasing them sort of over a period of time, and they will be posted on the website as well. So do want you to look to those. I know we're basically at time and we didn't really have a lot of time to sort of answer any questions beyond what was in the chat, but we are always available. There's our website and our email address if you want to contact us with any specific questions. But I also know that Rhonda and the team there are also sort of ready to provide support and services around this. So with that, I'll turn it back over to you, Rhonda.
Okay. Thank you both so much. That was fabulous overview. So yeah, as Simon said, just reach out if you have questions. My information is there. I will tell you that when I say reach out to us, that we can help you, it likely will be Jason. Definitely our expert with financial planning and working through these scenarios. And he has been involved with this tool since the beginning too. But certainly, we just encourage you to get in there, start using it, play around with it. Can't break anything in it. But just let us know if you have questions or if you run into any issues. And then also just please scan that code. I will also send the survey link out to everybody registered on ECP. We just ask for your feedback. This helps us continue planning and doing all of that stuff. So thank you all for joining us today, and just let us know if you have questions. Thanks.